The use of robotics in healthcare has changed how doctors diagnose, treat, and care for their patients. Robotics technologies provide previously unheard-of levels of accuracy, efficacy, and capabilities that improve medical procedures, boost patient outcomes, and transform the way healthcare is delivered. This video examines the developments and innovations in robotics that have affected the healthcare sector, emphasizing their significant influence on many medical specialties and the promise they represent for healthcare's future. Subscribe to our channel first and don't forget to press the bell icon. Number 15. Surgical robots. Medical robotics has become a revolutionary development in recent years. Robotic-assisted operations allow surgeons to conduct complex procedures with increased accuracy and reduced invasiveness because they provide higher precision, dexterity, and control. Intricate movements may be performed, hard-to-reach places can be accessed, and surgeons can use robotic arms with more precision when using systems like the Da Vinci surgical system. Robotic surgery lessens the trauma to the patient, reduces blood loss, reduces hospital stays, and improves surgical results. Number 14. Rehabilitation robotics. The field of physical therapy and rehabilitation has been revolutionized by rehabilitation robotics. Wearable technology and robotic exoskeletons help people with limited mobility regain motor function and enhance their quality of life. Patients recovering from neurological conditions, spinal cord injuries, or strokes can benefit from these devices' tailored therapy, repetitive movement capabilities, and real-time feedback. Robotic rehabilitation offers a more effective and efficient way to treat patients by tracking progress and allowing for tailored treatment strategies. Number 13. Robotic prosthetics. Technological developments in robotics have produced extremely complex robotic prosthetic limbs. With the help of these robotic prosthetics, people who have lost or have weak limbs can restore functional abilities and improve their mobility. Neural interfaces can be used to drive robotic prosthetics, letting users operate the device using their own neural impulses. Artificial intelligence and robotics are combined to improve the adaptability and reactivity of prosthetic limbs, giving users a more intuitive and natural experience. Number 12. Robotic pharmacy automation. Patient safety and drug management have both improved as a result of automation in pharmacy operations. Prescription dispensing, drug sorting, and inventory management procedures in pharmacies are all automated by robotic equipment. These technologies increase efficiency, lower the possibility of medication errors, and provide pharmacists more time to devote to patient care. Robotic automation in pharmacies makes sure that medications are distributed accurately and on time, improves prescription tracking, and reduces the possibility of human error. Number 11. Telemedicine and robotic telepresence. Robotic telepresence enables medical professionals to connect with patients remotely and give care and expertise when they are separated from one another. Real-time video consultations, remote patient monitoring, and virtual presence in critical care situations are made possible by telemedicine robots outfitted with cameras, screens, and sensors. In remote locations or during emergencies, these robots make it easier for patients and medical staff to communicate, ensuring quick access to care and minimizing the need for physical travel. Robotic telepresence increases patient involvement, broadens access to high-quality care, and boosts clinical outcomes. Number 10. Robotic aid in elderly care. Robotic aid shows considerable promise in overcoming the difficulties of providing for the elderly. Robots can be used to support daily activities, be a companion, and help with things like mobility aids and medicine reminders. Robots designed for social assistance provide emotional support, engage in cognitive training, and keep tabs on the health of old people. Robotic support for elderly care encourages independent living, lessens the stress on caregivers, and improves the general standard of living for aging populations. Number 9. Integration of AI and robotics. The use of AI and robotics together expands the potential and influence of robotic systems in healthcare. Robots can learn from data, adapt to changing circumstances, and make independent judgments thanks to AI algorithms. Robots are better able to comprehend and comply with human movements, expressions, and orders thanks to machine learning and computer vision technology. Intelligent surgical systems, individualized treatment plans, and intelligent healthcare solutions that optimize patient care and improve results are made possible by the marriage of AI and robots. Number 8. Robotic-assisted teaching for healthcare workers. Robotics is not only helpful to patients, but it also plays a big part in teaching healthcare workers. Medical students, residents, and practicing doctors can learn and improve their surgical abilities in a controlled and realistic setting by employing simulation-based training using robotic systems. Before performing surgery on people, medical experts can rehearse intricate procedures in a secure environment, improve their skill, and become proficient. In actual surgical situations, this training strategy maintains competency and enhances patient safety. Number 7. Remote monitoring and home healthcare. Robotics makes it easier to monitor patients remotely and provide treatment for them in their own homes. which lowers the need for hospital visits and increases access to healthcare services. Robotic systems with sensors and monitoring equipment are able to gather vital signs, monitor medication compliance, and identify any changes in a patient's health. Healthcare professionals can receive this data so they can remotely monitor patients and take appropriate action if necessary. Robotic remote monitoring improves illness management, allows for early intervention, and helps people with chronic disorders lead independent lives. Number 6. Precision medicine and robotics. By combining robotics with personalized medicine, it is possible to customize treatments for each patient. Robotic systems help with precision diagnostics, allowing for more exact illness definition and diagnosis. Additionally, they support targeted therapies like robot-guided radiation therapy, which precisely administers radiation to malignant cells while causing the least amount of harm to healthy tissue. Robotics helps to develop precision medicine by providing the best possible treatment results and reducing the possibility of negative side effects. Number 5. Robotics in mental health care. This topic is still in its infancy, but it has enormous potential. Autism spectrum disorder and dementia sufferers can receive assistance from robots created to offer social support and therapeutic interventions. These machines interact with patients, improve cognitive performance, and offer emotional support. Robotics in mental health treatment provides a complementary strategy to conventional therapies by offering a constant and understanding presence that improves patient involvement and well-being. Number 4. Robotics in emergency response and disaster response. Robotics is a key component of emergency care and disaster relief. In order to aid in search and rescue efforts, remotely operated robots with cameras and sensors can penetrate dangerous settings like collapsed buildings or nuclear accidents. The risk to human life is reduced because to these robots assistance in finding survivors, evaluating the building integrity, and giving first responders vital information. Additionally, robotic surgical systems can be set up in fetal hospitals during emergencies, allowing for the performance of life-saving treatments in difficult settings. Number 3. Robots ethics. The use of robots in healthcare creates ethical issues that require careful attention. To ensure patient trust and protection, concerns such patient privacy, data security, informed permission, and the appropriate use of robotic systems must be addressed. The use of robotics in healthcare should be governed by ethical standards and laws that encourage openness, responsibility, and ethical behavior. The ethical implications of robotics in healthcare must be discussed and made widely known if responsible adoption and risk mitigation are to be ensured. Number 2. Interdisciplinary collaboration and innovation. To successfully integrate robotics in healthcare, it is essential that engineers, researchers, and policymakers work closely together. The development of robotic technologies specifically suited to the demands of the healthcare industry is accelerated by interdisciplinary collaboration, which also stimulates creativity and the exchange of knowledge. Breakthroughs in robotics applications in healthcare can be made by combining knowledge from many disciplines, such as robotics, medicine, and computer science, leading to ongoing advancements and improvements in patient care. Number 1. Access and affordability. While using robotics in healthcare has many advantages, it's important to make sure that it's also accessible and affordable. Robotics technology should be made available to a variety of healthcare facilities, particularly those in underprivileged areas. In order to make robotics more accessible and inexpensive, collaboration between technology developers and healthcare providers can aid in the development of cost-effective solutions and the exploration of funding sources. To ensure that the advantages of robots in healthcare are felt by all facets of society, it is crucial to strike a balance between innovation and cost-effectiveness. This finishes our today's video. Like this video and make sure to subscribe to our channel for more amazing videos.